The landscape for prescribers is changing today. Many state licensing boards are adopting new rules or guidelines. Many of them are looking at the CDC guideline materials and trying to figure out, do they need to incorporate them? Prescribers really need to understand what their licensing boards are doing and understand how their rules and guidelines are changing, and then think of ways to put that into practice, especially in the area of documentation. Prescribers should be on the lookout for their own documentation. A lot of times prescribers don't really realize that they're not communicating what's in their head about the patient, and that's something that is very valuable not only to them in protecting their practice and providing quality care to the patient, but also if an expert or somebody from the regulatory board would come and look at their documents, it signals that they understand what they're doing. So prescribers should find a way to summarize where they are with their established patients. Bring it up to date. Tell people why you're prescribing the opioid, why this person should stay on opioid therapy, whether you've tried a taper, whether you're using additional types of treatment that are non-drug in nature. Things like that really signal to the regulatory authorities, you know what you're doing, you're taking care of your patients, and you're updating their treatment plan frequently. If you don't do that, that could really end you in hot water because the expert witnesses look for those things. And one of the other things I'd like to say that I think is important is when you have new patients or people that you've inherited, that type of an update or summary to see where the patient has been is very, very critical. And make sure that you're complying with your state licensing board requirements so that you're basically telling that board, I've done a treatment plan, I've examined these things, I've done the informed consent, the treatment agreement, and I have goals that we've set with the patient, and the patient's got a stake in this. They've got skin in the game, and we're working together to address their chronic pain issue. Opioids are either part or not part of the plan, and here's why. I think it's safe for primary care to be engaged in prescribing. I really think it's almost mandatory. And from a legal perspective, to me, coordination of care and having all healthcare providers address pain is really, really critical. I do think, however, though, that whether you're primary care or a pain specialist, you should really plan for having some sort of peer review or expert review at some point in time to take a look at your charting, and that you should always be aware that somebody else may have some input into this plan, and it would be good to seek other people's advice. It's like creating a witness for yourself. If you do a consult with a specialist, your primary care, get on the phone with a local specialist and really kind of get their buy-in to what's going on. You may find out that there's no problem with what you've created as a plan. You can continue forward, but then you know if something goes wrong, you've got somebody you can talk to. I think those relationships need to be better cultivated, and I think they're very valuable if it comes down to some sort of legal proceeding. You really want to have a peer as a witness, and you want to have their specialist in the community as a witness if you're primary care. And the specialists need to do the same thing, because at some point they might consider themselves end of the line, but if that's their thought process in approaching patients, that could really spell trouble for them, because it is valuable to have another person's mindset and a look over. And a lot of times those people may say, you know, you didn't really say what you thought you were saying in these records. Let's go back and you know, do it another way or make it more clear. Don't run out the back door when the pain patient comes to call on the family practitioner or even the specialist. Don't give it up. There's so many people that need help. And you know, you all will get through this challenge right now with opiophobia, but there are so many more good people that need your care. So stick with it and learn your licensing board rules or guidelines and try to follow those. Make your own checklist and really think about what you're documenting. Make sure you leave a cheese trail for the rats that might look at your chart.